Inflammatory bowel disease is a chronic illness that's characterized by inflammation of the colon. It follows a relapsing and remitting course, and it's typically diagnosed between the ages of 18 and 30. And somebody with IBD might experience a whole range of symptoms, and it's very different for different people. So at one end of the spectrum, you would have people who might be very ill and might be in and out of hospital a lot of the time. At the other end of the spectrum, you'd have people who are in remission for 10 or 20 years at a time with no symptoms. And then somewhere in the middle, you've got people who have periods where they're symptomatic and where they might find it hard to get into work. And treatment for IBD is with medication or with the surgery. And people often think that in a condition like IBD, where the symptoms are so unpleasant, that everybody would take their medication as prescribed. But that's not actually the case. My PhD was at the School of Pharmacy, University of London, and we were looking at why people don't take medication for inflammatory bowel disease. When we did a systematic review, we found that between 30 and 45% of people with IBD don't take their medicine as prescribed. And there are a lot of reasons why somebody might not take their medicines, and it's different for every person. But people's motivation to take their treatment is a very important factor in that.
All I knew about steroids at the time was that they were the scary things that bodybuilders took that made them really muscly. And I was 20 years old. I was scared of any kind of side effects like that. So I thought, I'm not taking those. So I hid what I thought were the steroids. The little white tablets that looked like paracetamol seemed quite safe to me. So I thought they must be the anti-inflammatories. But the red coated, scary looking things, they must have been the steroids. So sort of they got hidden away and didn't take them. And it's only sort of 2 or 3 days in, I realised that actually it was the anti-inflammatories that I'd been hiding and the steroids I'd been taking the entire time. But it's a very scary treatment to sort of be put on when you know nothing about it, when the doctors are busy and trying to sort of just treat the condition rather than helping you understand the condition.
There are a number of factors that might affect somebody's motivation to take their treatment for IBD. Firstly, they might not think that the treatment is necessary because they might not have symptoms at the time, or they might not agree with the diagnosis that the doctor's made.
When you're in complete remission, it's very, very easy not to take your tablets. You kind of feel like you're healthy. You don't necessarily want to take them because of these side effects that they can cause. It's very easy if you've had several weeks of feeling well to think, I don't need them anymore, and just stop taking them. And because you don't notice, or I don't notice a big drop between taking them and not taking them, it's very easy to think they're not doing anything, when obviously they are. And it's sort of building up trouble for when you then go into a flare-up and have to go back on them. There's a big amount of time before they'll start working again.
They also might have concerns, and these concerns could either be about side effects that they think might happen in the future, or about side effects that they think that they're experiencing right now. Also, people might not perceive that the medicine is working, and they're unlikely to take their medicine for that reason.
Drug and it has a lot of side effects, one of which makes your face swell up quite a lot if you're on a high dose, which I usually get put on when my Crohn's goes into a flare-up. As a girl, you don't like it when your face swells up, and obviously if you've got an event or something you want to go to, it's very, very tempting to try and taper off the steroids quicker than usual to kind of reduce the swelling faster. I recently did that. Usually you're meant to go down 5 milligrams every 7 days. I went every 5 days. Got off the steroids a lot quicker, but I went straight back into a really big flare-up, which actually meant that my chances of actually going to the event were a lot less because obviously I was quite ill. So.
And also it's really important, the relationship that a person has with their healthcare professional, and where that relationship breaks down, then adherence is much more likely.
I've actually seen 2 consultants about going on to biological therapies. It's quite interesting the different approaches that they took. The first one was much more self-assured about it and sort of believed that he knew best, and came across as very, you need to be on this drug, there are no other alternatives and there will be no side effects. The side effects are very rare, and for me that didn't work. I actually switched consultants because of it, because I'm the type of person that needs to know all the facts. Like, I'm not pessimistic about what could happen, but I would like to be prepared in the event that it did.
And the risk of non-adherence in inflammatory bowel disease is that the person then is much more likely to have a flare-up with bad symptoms that may even require them to be hospitalised. And obviously this is unpleasant for the person involved, but it's also costly for the healthcare payer.
There was a time where I didn't take my medication for 4 years because I'd moved to America, and it was much harder to get hold of it out there, and obviously it cost a lot more. And I mean, that was, in hindsight, that was a really, really stupid thing to have done, because as much as I was well for 3 years, 3.5 years, when the flare-up finally came, it did cause quite a lot of damage. It was quite a big flare-up. It caused a lot of scarring, and my Crohn's has never really been the same since. It's been a bit more severe since, because unfortunately with Crohn's, once the damage is done, once the scar tissue's there, it can't ever be, well, the only way it can be removed is with surgery. And so you're kind of constantly, one flare-up after the other is causing scar tissue and making your Crohn's worse.
Given that adherence is a problem in IBD, then it would make sense to develop adherence interventions. However, the research literature in this field is really in its infancy, and there are very few studies out there looking at how to improve adherence in IBD. In my PhD, I developed a website that used psychological techniques to reduce people's concerns about medicines in inflammatory bowel disease, and that proved pretty effective. And so I think this is an area where there is a lot of scope for further research.